CDC cut the quarantine time for someone infected with the virus. After 5 days, if the person does not have any symptoms, they can go about their normal activities, but must wear a mask for 5 more days. And if you're boosted and exposed to someone with COVID, you can skip quarantine, but still must wear a mask in all settings for 10 days. Checking the latest positivity rates for everyone in the tri-state area, New York State reported more than 26,000 new cases and a positivity rate of 16%. New Jersey, more than 8,800 new cases and a positivity rate over 21%. Connecticut reporting more than 14,000 cases since Thursday and a positivity rate of more than 10%. And New York City Transit says it will be running fewer trains through Thursday because of employees affected by COVID. Free testing was offered to the public today at the Times Square subway station and at Grand Central Terminal. Still, we saw more lines for testing elsewhere. PCR testing and rapid testing still in high demand. This was the scene on the Upper West Side. And that's where we begin our coverage with Eyewitness News reporter Josh Einiger. Josh?
Well, Sandra, we're here outside of Mount Sinai West Hospital, one of many hospitals in the city that are seeing increased demand for services now with the Omicron variant running through the city population. There are, however, very clearly 2 different groups being impacted by Omicron. There are the people who are vaccinated, who, as the CDC says now, can emerge from isolation much faster than before after they're infected. But then there's the unvaccinated, in particular unvaccinated kids, who are now being hospitalized at alarming rates. With the Omicron variant shattering records for infection across the state and amid a case rate not seen ever in the pandemic, today the state health commissioner, herself recently recovered from COVID-19, was sounding a new alarm, an urgent warning about people's kids.
What I hope parents do is protect their children who are eligible for vaccination by getting them vaccinated. Our vaccination rates in 5 to 11-year-olds remain disappointingly low.
Unvaccinated children are being admitted to hospitals at a staggering rate. In the city, pediatric hospitalizations have skyrocketed nearly 5-fold in just a matter of weeks, from 22 cases early in the month to 109 last week.
It's clear that vaccination really reduces the chance of severe illness, and boosting, if you're eligible for it, adds to that.
And so today, the state-run MTA started offering vaccines and testing in the subway, first at Times Square and Grand Central, and soon to be rolled out in busy stations elsewhere through the system.
We want to be safe. We want to be sure that we are okay and travel again to our country.
Meanwhile, today was day 1 of a first-in-the-nation mandate, the city now requiring all private employers to obtain proof of vaccination from every employee. Vaccination, the mayor insists, is the silver bullet. It may not be preventing tens of thousands of New Yorkers from contracting the Omicron variant, but it is keeping them out of the hospital. And the mayor says that's all that matters.
The vast majority of people are moved by both the science but also the practicality of something like a mandate. That's why we have 91% of adults in this city have had at least 1 dose, 94% of the city workforce. I mean, if that isn't a recommender for mandates, I don't know what is.
Mandates and incentives, since the mayor announced a cash incentive for people to get boosters just last week. 180,000 New Yorkers have rolled up their sleeves for a booster shot. We're live on the Upper West Side. Josh Einiger, Channel 7 Eyewitness News.